Well, thank you very, very much, everyone, for coming, and certainly good afternoon. This information session is specific to CRIO, so our collaborative research and innovation opportunities. We've been going around the province over the last month or so talking about the 6 new programs that have already been launched, or opportunities that have been launched by AIHS. There are more coming in terms of a couple of the working groups that are still putting their recommendations forward to the board. I thought I'd start today with a little bit of background on AIHS and contextualize where the CRIO program or opportunities have come from that will help you to understand perhaps some of the thinking. And then I hope to leave a lot of time for question and answers at the end, because I'm guessing that's probably what's going to be the most value to you. Our organization has undergone some change in the last few years, and certainly became Alberta Innovates Health Solutions in 2010. And this has provided, and the quote relates to it, has provided what we think is some really great opportunities that we have in front of us in the 2012 year. We are looking to not only have success as the new organization, but seeking to have significance, making a difference. And to that end, the vision for our organization is to transform health and well-being through research and innovation. The mandate of the organization in its most simplistic form can probably be distilled into the 6 words that are highlighted in blue there: to support health, research, and innovation activities. But there are details in that mandate that are important, including the fact that we are aligned to meet Government of Alberta priorities, and I'll come back in a few minutes and talk about those priorities, and to benefit the province both in terms of economic and social well-being for Alberta, and thereby will direct our activities at both at the discovery of new knowledge as well as the application of knowledge. In terms of how AIHS is going to create value, certainly investing or continuing to invest in excellence, focusing our investments, and I'll talk a little bit about priorities in just a moment and how those have been established. Optimizing the capture of benefits from these investments, demonstrating accountability and impact of those investments, and certainly enhancing the potential for private sector in Alberta. The shift in thinking is perhaps to one for the organization of being a very interested investor. Under the old funding model, the business model was probably doing all the due diligence on the front end, holding that competition, holding those peer review processes, and then asking you to report back once a year, and at the end of the 5 years, you came back and competed again. I think we're far more of an interested investor in those activities that we will be supporting, financial and otherwise, going forward. There has developed or emerged, perhaps from our strategic planning process, a number of guiding principles for AIHS. That of provincial level integration. So I'll talk in a minute about the Alberta Health Research and Innovation Strategy that's been developed by the province. There is certainly provincial level integration happening for Campus Alberta. Innovation is linked to outcomes, and we are looking at value added impact in 5 categories. So we've adopted adapted version of the Canadian Academy of Health Sciences framework that looks at those impacts in 5 different categories. We believe that collaboration as a focus is key to solutions, that partnership and leverage are important to meeting our objectives. There will be focused investment going forward, that there will be a balance of the kinds of investment that are made, and we've heard loudly from the stakeholder groups that we've engaged in discussion the need for flexibility. And again, I'll come back to that when we start talking about CRIO specifically. And consideration for both those strengths that occur in Alberta, the strengths that we know, as well as potential needs or opportunities in terms of forward investment. So the Alberta Health Research and Innovation Strategy is depicted here. It was a strategy that was co-developed by Alberta Health and Wellness and Advanced Education and Technology, and identifies 3 basic strategic priorities: wellness at every age, innovative health service delivery, and broad socioeconomic benefit to the province. So when we begin to talk about the CRIO opportunities, this is the framework that you have to be thinking about in terms of fitting yourself into the various priorities that have been identified for our organization and others within the province. This schematic depicts the knowledge to innovation framework. Certainly, as one of the key inputs to that framework, the AHRIS priorities. The input identifies for us knowledge needs, gaps, or opportunities. And foundational to all of those activities in the middle there, certainly the 3 enabling actions that were identified in the AHRIS document: highly skilled people, knowledge translation, and innovation platforms. Ultimately, AIHS is looking for impact on health, health systems, and broad, and perhaps more long-term, broad socioeconomic outcomes. At the beginning of AIHS, and certainly in 2011, the board of directors of the organization created a strategic implementation or planning process through broad stakeholder engagement. So we've certainly spent a lot of time in the last year engaging with various groups of stakeholders. They created at the front end an oversight committee that has looked at and developed processes and reviewed progress on that planning process, and identified those 3 foundational working groups that they wanted to get going at the outset: highly skilled people, knowledge translation, and innovation platform. And the CRIO portfolio of opportunities is a direct result of the discussions that happened around the highly skilled people working group and the broader stakeholder consultation that was completed. We are now done our initial phases of the strategic planning process, and there is an expectation that the knowledge translation and innovation platform working groups are about to put their recommendations in front of our board in March. The HSP working group has also recognized or recommended a number of other opportunities, and certainly there's going to be a balance in terms of the kinds of opportunities that are provided. We can think about it certainly in the context of short, medium, and longer term investments, PI-driven, translational, or applied. And so today we're going to be talking about specifically the collaborative opportunities that are in front of us with looming deadlines. We do recognize that we are opening these opportunities to a broad group of stakeholders, and certainly we can describe it in terms of stakeholders or market segments. And the CRIO opportunities are certainly targeted at those broad group of stakeholders. So let's get right into the meat of it and start talking about what is this CRIO thing. The objective is certainly to catalyze and support collaborative, interdisciplinary, multi-sectoral, and/or multi-institutional research with a focus in terms of finding solutions to complex health problems or issues. The intent is to engage knowledge or end users in the process to maximize the potential impact of the work that's being conducted. It's to provide an opportunity to take advantage, certainly, of national and international activities, and to provide opportunities in terms of interdisciplinary research, training, and mentorship. Some of the key features of CRIO, it's certainly one of the things we've heard, as I said, from most of the stakeholder groups that we talked to, was it's about flexibility, that one size didn't fit all. And so when I start to talk about the portfolios, that was the thinking, that there had to be the right fit for what was being identified as a need to meet a particular objective. Excellence will remain a key determinant for investment of AIHS activity, and certainly the activity will be focused on solutions with an emphasis on knowledge translation. And the intent or the expectation on the part of AIHS is that there will be the potential for relatively timely, whatever that may mean, health system impact, and more broadly socioeconomic impact. And that there's an opportunity here for partnership development, whether that's financial or otherwise. Knowledge translation we define very broadly, and so we have adopted the CIHR definition of knowledge translation, the exchange, synthesis, and ethically sound application of that knowledge. And so from that perspective, we're thinking about it in the broadest sense of the definition. So the 3 pieces to the portfolio at this point in time are the collaborative project, the collaborative program, and the collaborative team. The project is meant for a smallish group of collaborators, let's say approximately 3, but to work on a fairly defined project. This is time limited. It's 3 years in its duration and would provide up to $250,000. The collaborative program is meant for a little bit larger group of collaborators, perhaps a bit more complex program of interdisciplinary research, up to $500,000 available for up to 5 years. And the collaborative team, expected to be a fairly large collaborative team or network, and certainly tackling a relatively complex health issue where it requires the involvement of many stakeholder groups, up to $1 million a year for up to 5 years. I think that the buckets, while discrete, the thing that you might want to be thinking about in terms of fitting into this particular scheme is to be thinking about defining those needs that you have in terms of accomplishing the particular objective that you're setting out and seeing where you fit in this particular schematic. When you make an application to the organization and the project deadline is upcoming, I'll talk about that in just a minute, you have to pre-identify yourself which opportunity you're looking to come in. We're not going to move applications from one category to another. So who's eligible? Well, you need to have some collaborative leaders, and certainly there's an expectation that there's some demonstrated leadership in terms of having moved forward collaborative or team activities. There is a limitation that an individual can serve as a leader or a co-leader of only one CRIO opportunity at a time. The collaborative membership would be defined as is needed to meet your particular objective, but certainly can incorporate individuals from outside of Alberta if that's what you're going to need to be getting to the objective that you're planning. The involvement of a knowledge or end user. We're certainly encouraging interdisciplinary, multi-institutional activity. And there are some requirements in terms of project management and governance structures in terms of the collaborative program and collaborative team activities. In terms of what we have defined as a knowledge or end user, this is an individual playing a key role in terms of knowledge translation of research, potentially into health outcomes, and can be, as you can see from the definition, a number of kinds of individuals that may serve as that knowledge or end user. They may participate in the research in many very different ways. So certainly we've outlined a number of potential roles that those knowledge or end users may play in the context of the collaborative opportunities. The funding that is available can certainly support a broad range of collaborative related costs, research operating costs, including human resources, infrastructure, data collection and holdings, networking, disseminating, linking or knowledge exchange activities, training, and there's some limited release time in terms of leadership of these collaborative opportunities. At the end of the day, it's meant to be, and this is not all-inclusive, so there may be other costs that aren't mentioned, but certainly is not meant to be a replacement for an operating grant of a particular PI. And so at the end of the day, the activity is meant to support the collaborative activity as opposed to an individual's activity in that context. For the 2012 year, we have implemented a staggered approach in terms of how we're rolling out the portfolio of activities, with the project coming first. There is an upcoming registration date of March 5th for the collaborative project, and then the program and team opportunities will roll out starting with a registration in July. In terms of what we are asking of you on this three-phase application process, the registration is just meant to give us a bit of an administrative heads up on what we're going to be looking at in terms of those applications. So we're asking you to give a very minimal amount of information, who your team is, what your title is, and a paragraph on what the intent is. It's not being reviewed. It's only giving us some ability to react in terms of putting together our committee membership. The letter of intent, and I'll just flip back, the letter of intent for the project is April 2nd deadline. It is a 2-page letter of intent and is asking you to define the collaborative project program, to identify those potential collaborative membership, to outline the fit of the proposal to the key requirements of the program, and to broadly highlight where you think that the resource requirements exist. We've been asked a lot of questions already in terms of how much information can change between the registration and the LOI stage. Well, I imagine that there will be some changes in terms of your developing activity. There has to be the same name so that we can track from registration to the LOI stage that who you are. So there's got to be some continuity, but we recognize there will be changes. In terms of the full application, it's a detailed proposal, and you can see there's 7 categories we're asking for information on. It's 12 pages in its total, and we are asking for a research management plan to lay out some key objectives, some milestones or deliverables, and the timelines that those would be achieved on. And then, of course, a more fully fleshed out and perhaps justified budget. In terms of what we're asking, and this is available on the website, so I'd really encourage you to go and look at the program guide. In terms of what we're going to ask the peer review committee members to assess your applications on, the significance or the innovation of the proposal that you're putting in front of them, in a sense, the relevance to the work that you're proposing to do, in terms of approach, the methodological approach, but also why an interdisciplinary approach is important. In terms of the collaborators, who the team is, their track record, what each collaborator would provide in terms of meeting the proposed research goals. The environment broadly in terms of that collaborative group and the environment that they would work in, the training program that may exist or opportunities that may exist, and the broader institutional support that may be provided. And in terms of engagement with the end users or collaborators, the role that end users or partners may play, and we are asking for a KT plan. So I'll leave it there and open it up for questions.